Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about the future of longevity, exploring replacement therapies. Aging, a physical wear and tear process. The premise behind replacement therapy often posits that aging, at its core, is more of a physical process than purely a biological one at the cellular level. While cellular hallmarks certainly play a role, a significant portion of age-related pathology, particularly in the later stages, is believed to reside in the extracellular components, the scaffolding and environment surrounding our cells and tissues. Think of it like a machine. Individual cells might still be okay, but the pipes, wires, and structural supports of the organ or tissue are degrading. This perspective suggests that rather than solely focusing on molecular repair within cells, we could achieve longevity by directly replacing the worn out parts. So, what is replacement therapy in this context? Unlike strategies that aim to slow aging at a cellular level, like targeting hallmarks, replacement therapies aim to directly substitute or augment tissues or whole organs that have become dysfunctional due to age or disease. The idea is straightforward. If a component of the body is failing, replace it with a new functional one. This approach seeks to bypass accumulated damage and restore peak performance, theoretically extending the functional life of the organism. Current realities, organ transplantation. While the concept sounds futuristic, organ replacement is already a reality. Organ transplantation is a well-established field of medicine that has saved countless lives. Organs like the kidney, heart, liver, and lungs are routinely transplanted, dramatically extending the lifespan and improving the health span of individuals suffering from end-stage organ failure. This existing medical practice forms the foundational proof of concept for replacement therapy. It demonstrates that the human body can accept and integrate new functional organs, albeit with the challenges of immune rejection and donor availability. Advancing the frontier, tissue engineering and synthetic limbs. Beyond whole organ transplants, advancements in other fields are pushing the boundaries of replacement therapy. Tissue engineering. This involves growing new tissues or even organs from a patient's own cells in a lab, often on biodegradable scaffolds. The goal is to create functional biological replacements that minimize rejection. Synthetic limbs, advanced prosthetics. Modern prosthetics are becoming increasingly sophisticated, offering advanced dexterity, sensory feedback, and seamless integration with the user's nervous system. These technologies aim to replace or enhance specific body parts, improving function and quality of life. The ambitious future, whole organ and progressive replacement. Looking further into the future, the concept of replacement therapy for longevity becomes even more ambitious. The idea is that multiple organs could be progressively replaced as they age or fail, or even that whole body replacement could become a possibility. Imagine a scenario where aging individuals could systematically receive new youthful organs, kidneys, livers, hearts, and even the thymus, which is crucial for immune function, ensuring that the body's internal systems remain optimally functional throughout an extended lifespan. This proactive replacement would aim to prevent age-related organ failure before it becomes critical. The ultimate frontier, brain transplants and brainless bodies. the most speculative and ethically complex frontier in replacement therapy involves the brain. It may be possible to grow a brainless body, then transplant brain cells, which can become functional. This concept, while currently in the realm of science fiction, highlights the theoretical ultimate goal of extending consciousness and identity beyond the limitations of the aging physical body. It raises profound philosophical and ethical questions about identity, consciousness, and what it means to be a human, far beyond current scientific capabilities. Challenges and complications. While the vision of replacement therapy for longevity is compelling, the current reality presents immense challenges and risks. Surgical complexity. Any major replacement procedure is a complex surgical undertaking carrying inherent risks or complications like infection, bleeding, and adverse reactions to anesthesia. Immune rejection. The body's immune system naturally recognizes transplanted tissues or organs as foreign and will attempt to reject them. This requires lifelong immunosuppressive drugs, which carry their own significant side effects, such as increased risk of infection and cancer. Donor availability. For human organ transplantation, the severe shortage of suitable donor organs is a major limiting factor. Ethical considerations. The ethical implications of growing organs, genetic engineering for compatibility, and the very concept of extending life through radical replacement raise profound societal questions. Cost. Such advanced therapies would undoubtedly be incredibly expensive, raising questions of equitable access. Conclusion. A vision for the future, grounded in science. Replacement therapy for longevity represents a bold vision, pushing the boundaries of what's medically possible. From the established success of organ transplantation to the ambitious frontiers of tissue engineering and beyond, the scientific drive to overcome the physical limitations of aging is undeniable. While significant challenges in surgical complexity, immune rejection, and ethical considerations remain, ongoing research continues to explore these pathways. This field, while speculative in its most radical forms, reminds us of the continuous human quest to extend not just lifespan, but crucially health span, allowing more individuals to live longer, healthier, and more vibrant lives. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thanks again.